In this episode of Ergo, we're talking a budget that not only cuts, but kills.
I'm pulling my weight in gold. Got me anxious, got me broke, but I can't live this on my
own. Welcome back to Ergo, everybody. I am your host, Brandon, here in Ohio. And in today's episode, we're going to be talking about Donald Trump's new proposed budget. Also, we will have a great interview from a good new friend of mine, Peter Morley, joining us from Manhattan, New York. He will be discussing Medicare, Medicaid, and how it is in ties with Donald Trump's budget. So, before explaining the context, before giving you the content, which is what I normally try to do on this show, before we jump into Donald Trump's budget, we're going to explain one key principle that I would like for everyone to remember when watching the news and even watching this show moving forward. That principle is the Congressional Budget Office. The Congressional Budget Office is an independent branch of Congress, and what it does is evaluate and estimate how a proposed law, also known as a bill, will affect our economy and how it will affect all of the citizens of the country. When we say it is an independent branch of Congress, what we mean is that there are no Democrat and no Republican influences. It is nonpartisan, meaning people are simply looking at what the bill states is going to do and how it will affect the people. They're not going to alter the results. They're just going to give us a true, raw estimate. Okay, now moving into the budget. We're going to start off with SNAP, which is known as Supplemental Nutritional Assistance Program. It is also known as food stamps. And what it does is it provides means for acquiring food for families that meet certain poverty levels. Donald Trump, in his new budget, wants to cut SNAP by $191 billion, and that's billion with a B. This is a total of 25% of the entire budget for SNAP. And in addition to that, he wants to enforce additional work requirements on those receiving SNAP benefits. So, think about those who are on SNAP benefits and can't work. This type of cut, even with looking for work requirements to make people ineligible for food stamps, it's still going to kick off a lot of people, leading to a lot of people going hungry and a lot of people in desperation. But that's not even the half of it. The next one we're going to talk about is the Earned Income Tax Credit and the Child Tax Credit. The Earned Income Tax Credit is a refundable tax credit that low to moderate income American citizens or American families receive when they file their taxes each year. The Child Tax Credit is a tax credit that each American receives for having a dependent child that is under the age of 17 years old. Donald Trump wants to cut both of these by a total of $40.4 billion. And of course, he has additional stipulations to that. He wants everyone who is looking to receive the child tax credit to enter their Social Security number into a separate system. He's doing that to weed out illegal immigrants, regardless of whether their child is a U.S. citizen or not. Believe it or not, you can be an illegal immigrant that came to the United States, and if you had a child on United States soil, your child is a citizen and you are not. The next thing we're going to talk about is temporary assistance for needy families, also known as welfare. And what it does is it actually provides cash and other financial means to needy families that need this type of income, and it does it on a temporary basis for those who meet that poverty level. Donald Trump wants to cut this by $21.6 billion. It may just be me, but he certainly has a thing for billions. You know, he claims to be a billionaire all the time, and we have seen several reports that refute that he's a billionaire, but we're not going to go there. That $21.6 billion is a total of 13% of the welfare funding. But don't fret yet, because there's more. Here we go. The Environmental Protection Agency, which is established to protect environmental health, it is proposed to be cut by 31.4%. The State Department, which is established to make and conduct foreign diplomacy and foreign policy, he wants to cut that by 29.1%. The Labor Department, which is established to regulate standards of occupational safety and to regulate wages, etc. He wants to cut that by 19.8%. Health and Human Services, which is established to protect American health and provide human services. 16.2% cut. Housing and Urban Development, which is established to meet the housing needs and provide fair housing opportunities, is going to get a 13.2% cut if it becomes law. Education, which the Department of Education is what we're speaking of, which provides federal aid to educational institutions and sets educational standards. He wants to cut that by $9.2 billion. Now, to take a sidebar to that, I for one say that we as adults can argue all day long about whatever issue it is that we have with each other. Most of it is just chasing after wind. Most of it is just futile efforts to hurt each other. But I for one stand by the fact that the innocence of a child should never be threatened or tested. We should not be bothering children's education. They are our future. They are the ones that are going to take care of us when we get older. They deserve better than what we have had. They deserve better than what we have given them currently, and we cannot fail them now. Off of my soapbox, Social Security Disability Income, which is a federal program that provides income to Americans who meet the definition of being disabled. After stating that he would not cut, not touch, not bother Social Security whatsoever, he now wants to cut it by a total of $72.5, here we go again, billion. Medicaid, which is an insurance program providing health insurance for low-income Americans. If that American Health Care Act becomes law, Medicaid will be cut by $880 billion. Donald Trump, in his budget, wants to take more than that. He wants to take off an additional $610 billion. And with both of these cuts to Medicaid, that comes to a whopping total of 47% of the total of Medicaid's funding, which means that people who are on Medicaid are going to suffer a mighty blow because nearly 50% of its funding is going to go bye-bye if the Republicans have their way in Congress. I'd be remiss to not tell you that Donald Trump doesn't plan for these cuts to happen immediately. His budget says that these cuts are to take place over 10 years, which is typical of any presidential budget. However, Donald Trump has a lot of uphill battles concerning this. Number one, in determining this budget, his manager of office and budget, or office of, I don't know what the office is called, but it's the budget office. His name is Mick Mulvaney. And he's in charge of preparing this budget that Donald Trump would call his own. So it should not come as any shock, surprise whatsoever that there was a $2 trillion math error in their budget, and none of this is going to work. In addition to that, Donald Trump stands by his budget, and he's saying we have to do these type of budget cuts because we want to give the greatest tax cut in history. He says that this great tax cut will drive our economic growth as a country to 3%, 4%, 5%. However, every economic expert that I've seen on record has said we're only going to stay at 1.9%. In fact, Let's take a look at what Ali Velshi had to say on All In with Chris Hayes on MSNBC.
Republicans have spent a lot of time under Donald Trump talking about, quote, tax reform.
So now we're going to go for tax reform, which I've always liked.
We will get tax reform done.
Tax reform will stand on its own 2 feet.
Tax reform, tax reform, tax reform. So tax reform.
Massive tax reform, tax reform, tax reform, massive tax reform.
Okay, but tax reform has a very specific meaning in this context. It means reforming the tax code in a way that doesn't add to the deficit. Anything else is just a deficit-financed tax cut. And the White House today, Treasury Secretary Steve Mnuchin was proud of the Trump administration's proposal for what Trump calls the, quote, biggest tax cut in U.S. history.
Does it pay for itself? Is this plan revenue neutral?
This will pay for itself with growth and with reduction of different deductions and closing loopholes.
Well, we've heard that before. Republicans have been claiming for decades that growth will pay for tax cuts, even though the data simply doesn't bear that out. A former Obama economic advisor, Jared Bernstein, told The Times there's not a shred of evidence to support the secretary's pay-for-itself claim. The reality is, as the Washington Post points out, many budget experts believe the White House's plan would reduce federal revenues by so much it would grow the debt by trillions of dollars, and that Trump's so-called tax reform is just the latest example of a Republican president working to massively cut taxes for the wealthiest Americans, regardless of the cost. Joining me now, MSNBC anchor and correspondent Ali Velshi. And Ali, I want to zero in on this difference, right? Because there's this idea that once-in-generation plans for tax reform, which is to change the tax code in all these ways that's fundamentally different to neutral. It's not about cutting taxes. It's about reforming the system.
Right.
That's not what we're going to get.
No. This isn't tax reform. This is just a tax thing that increases the deficit, which is, again, not a major problem to everyone, except if you're one of those people who really hates increasing the deficit and you say you're not going to. And this old canard that somehow we're going to grow our way out of it. Last summer in New York at the Economic Club, Donald Trump said that his tax plans are going to cause the economy to grow 4, 5, or 6%. Chris, we're at 1.6%. Virtually nothing short of war causes a mature economy to grow that much. I have a better chance of growing a full, thick afro than we have of getting to 4, 5, or 6%. So we just have to accept this is what it is. It's a deficit-financed tax cut. End of story.
Right.
As stated from Ali, that 3%, 4%, 5%, 6%, it's not going to happen. He just wants a tax cut for him and all his millionaire friends, emphasizing the word millionaire. But don't fret. Again, I say that a lot. Don't fret, because there's more. Donald Trump, he doesn't just want to cut all of this spending from all of these different essential programs to the everyday lives of American people. He wants to spend some money, and this is where he wants to spend it. He wants defense spending to increase by 4.6% each year, which comes to a total of $25.4, drumroll, billion dollars. He wants Homeland Security spending to increase by 6.8%. He wants Congress to set aside $2.6 billion for his border security, vis-a-vis the wall that's never going to happen. And he wants to increase the spending of the Department of Veteran Affairs by 5.8%. Now, while not going too deep into this, because I don't want to go over too much on the time that I'm allotting myself for the show, I do want to explain this to you before people get more frightened than what they already are with this terror in the White House. In order for anything to become a law, it has to go from the House to the Senate, back to the House, back to the Senate again, and then it goes to the President to sign. Okay? That first trip of it being in the House of Representatives, which is what I mean when I say House, the House of Representatives, is going to pass no problem, because the Republicans are in the majority, and they pretty much do whatever the House Speaker, Paul Ryan, tells them to do. So it's going to pass the House. However, in the Senate, they have to have 60 votes in order for something to become law. 60 out of 100 senators. Currently, there are 52 Republican senators, and they have the majority. But again, there's 52. There's not 60. There are 46 Democrats and 2 independents who vote with the Democrats, which means that they'll need to pick off 8 of those other people to vote for this insane budget. In other words, it's not going to happen. All right, so now that we've kind of explained the high points of Trump's budget, we're going to take a break, and when we come back, we're going to have Peter Morley on, and instead of doing my usual ending segment, I've come to conclude. Peter Morley gave us some great words in his interview, and it moved me so much to let him close today's show, so he will be the one coming to the conclusion. I'll see you after the break. Like, follow, and subscribe. Get the latest from Ergo on Twitter, Facebook, Instagram, and YouTube. Contact information below. All right, so in what ways are Medicare and Medicaid connected with each other? As in, that's to say, how does one affect the other?
Okay. I mean, I could pretty much speak until like I'm blue in the face with this one. There's so much codependence on these issues. But I think I think a major way that they are interdependent on each other, especially for people who are eligible for Medicare and Medicaid, is it's when they're something called dually eligible, and they qualify, for both Medicare and Medicaid, and then there are these programs for these people called Medicare Savings Plan, and they're state-run through Medicaid, and they have eligibility and resource incomes that are dependent. That, Medicare is a federal program, Medicaid is more of a state, funded program. So, but each state sets its resource and income level, and they're determined by each state. And there are 4 types of Medicare savings program, each with different eligibility requirements. These income requirements are usually above the qualifications for Medicaid. Medicaid, I believe, it changes every year. It increases a tiny bit every year, but I believe it's around $850 now. I'd like to say I might be a little off on that number. Apologize. But the 4 types of programs. One's called the Qualified Medicare Beneficiaries Program, and that helps pay for Medicare's Parts A and B premiums, deductibles, copayments, and insurance. So, in other words, if you have Medicare, most of the time you need a supplemental plan to help pay for. Medicare pays for 80% of your healthcare coverage, and then Medicaid, if you're dually eligible, will pay for the 20%. Then the next. Anyway, yes, I live in New York. There's always noise, including your telephones. The next level is the specified low-income Medicare beneficiaries level, and that helps pay for the Part B premiums only. So your income would be a little higher at that level. Well, let's say I'm just using random numbers because every state is different. So let's say if you're qualified, again, this is hypothetical. If you're qualified for be on Medicare at $850, the QMB program, that first program I just spoke to, let's say you're qualified if your income is $950 or anything anywhere between $850 and $950, and then the specified low income Medicare beneficiary, let's say that's like between $950 and $1,050, and then the next program is called Qualifying Individuals, which helps pay for the Part B premiums only as well. And then there's the last level, which is like basically the highest qualifying income level, is called the Qualified Disabled and Working Programs Individual, which helps pay for the Medicare Part A premiums only. And just to make you aware, when you say Medicare Part A, Medicare Part B, Medicare Part A, that's hospital coverage. Part B are like your medical doctors. Part A also covers lab tests as well. It's like different parts of Medicare. There are actually 4 parts of Medicare. There's Part A, which again is the hospital lab work and radiology testing as well. Then the Part B is your medical doctors, any outpatient services at hospitals. Part C is what they call a Medicare Advantage plan. It's Part A and B is traditional Medicare. Part C is the Medicare Savings Plan, where you basically still pay your premiums, but you're basically in a managed program, and there are times where you won't have any deductibles. Any co-payments when you see your doctor, but you are limited to a smaller network of doctors. So usually people get the Medicare Advantage plan or the Part C Medicare when they aren't ill or chronically ill. That it'll end up costing them a little less, but it's also a gamble at the same time. And then there's the Part D, which pays for your prescription drug plan. And that has this, it's depending on the program, it's restricted to. Now, I'm just going to speak to this for a second because there is a Medicaid program called Extra Help when you're in a Medicare savings program that pays for your co-payments and pays for your prescriptions. And basically, if you're at a certain income level, depending on what your income level, that's what this program called Extra Help will cover. And again, this is a Medicaid-funded program, and it does pay for that Part D part of Medicaid. It won't pay for you also will have a premium for Part D, your prescription plan, but Extra Help may or may not cover that as well. But if you enroll in a Medicare savings plan, you'll also automatically get Extra Help, if you're at that level. So you don't even have to apply for it separately. Sometimes people apply for Extra Help separately, and then they find out that they're qualified for a Medicare savings plan. So this isn't like a very well-known program. The people outside, even people I've spoken to who have been on Medicare or Medicaid, they're not familiar that, number one, they might be eligible for both, or number two, that these programs even exist. And basically, to qualify for one of these programs, you have to qualify for Medicare Part A, and that's most people who have worked, through their lives. Now, some people may have never paid into Part B, so at 65, they can become eligible for Part A, but they may have to pay more for Part B because they weren't eligible for it. But most people are eligible. Most working people are eligible for Part A and Part B. But if you do not have Part A but meet like the first level of the qualified Medicare beneficiary level, your state will will have you do a process to allow you to enroll in Part A. But many states throughout the year, when others can limit, because you can only do this at certain points of the year as well. And again, some states are more lenient and some states aren't. So again, even though we talk about Medicare as a federally funded program, when you bring a Medicare savings plan, even though it has the word Medicare in it, it's funded by Medicaid, so you're going to have to defer to the rules of your state. This is a lot of information, so I recognize that. So, this is, I would encourage whoever is listening to this to look up Medicare Savings Program for greater detail, because it would definitely help you understand. But just think
if the AHCA or the American Health Care Act, that new law or bill, that they want to sign into law, if it becomes a law, or if Donald Trump has his way with his budget, as I'm going to be discussing on this episode that you're going to be featured on, what effect will that have on Medicare and Medicaid?
Okay. Well, I mean, there's so many implications, as we know. Now, I am going to speak to this as best as I can because, number one, the AHCA is not like readily available for review.
Right.
But and the budget has come out, and there's like double implications for people on Medicaid. I mean, specifically, I'll speak to Medicaid very briefly, because if you are on Medicaid, girl, you're in trouble.
Big trouble. They want to cut it by 47%.
Big trouble. So you must call your reps. You find out who your 2 state senators are and your congressperson, and you call them every day and you remind them that you are in jeopardy, because we are not on Medicaid because because we want to be on Medicaid. We're on Medicaid because we need to be on Medicaid, no matter what your reason is. And it starts with you. It starts with you protecting yourself. And that's one thing that I've learned. I thought voting was enough, but no, calling, and they want to hear from you. They do want to hear from you. And I call, I email, I fax, I Twitter, I do everything. Tweet, sorry. I do everything I can. I try to engage with people. And look, I know there are people that are very chronically ill. I'm chronically ill. There are people that may not, want to speak out. I understand. I just encourage you to speak out for yourself, or if there's somebody listening to this who's a caregiver for someone, I encourage them to speak out, because what I'm about to speak about is kind of frightening. But a lot of people don't understand the implications to Medicare. So I'm gonna try to speak with that, if that's all right. I think it'll help put a few things in perspective. But there were 2 organizations that, when the first AHCA that came out in March, and they were able to analyze, and these 2 organizations were the Kaiser Family Foundation and the Center on Budget and Policy Priorities. And they identified the AHCA's Medicare's provisions and illustrate the potential impact of the changes. Now, often overlooked, the Affordable Care Act's many Medicare provisions altered both the financing and services of the program, including the closing of the Part D prescription drug, which we refer to as the donut hole. And that's a hole where you actually have to pay everything out of pocket. And getting back to what I was saying about extra help, I am subsidized. I still have to pay co-payments for my drugs, but it's June 1st today, 2017, as we are recording this. From January 1st to June 1st, I would have had to pay about $14,000 out of pocket. If I did not have extra help, I would have paid I take between 20 and 25 medications a week, depending on the month. And this doesn't include my infusions for my Benlysta, which is a medication for my lupus. I actually have to go to the hospital and get that infused, and those infusions cost about between the blood work that I get beforehand, between the care that I get, it ends up costing. This is all outpatient. It costs about $6,000. I'm very popular today too, by the way.
So don't even be worried about that.
So it's a lot of money, and there's no way I would have been. I don't have the resources for it. I don't. I don't have savings. I've been disabled since 2007. I had, just briefly, three spinal fusion surgeries. They all failed, and then I was diagnosed with kidney cancer. And fortunately, I'm in remission. And then I was diagnosed with lupus. So I basically I call myself a professional patient. And when I'm not speaking about all these Medicare and Medicaid scary issues, but getting back to those. So just so everyone knows where I'm coming from. And you know, this is where my passion comes from to make sure that these programs come to fruition. But getting back to what I was saying about these two programs, again, they are the Kaiser Family Foundation and the Center on Budget and Policy Priorities. But we're talking about the donut hole. And while the AHCA does not address the two first provisions, it does not eliminate the additional payroll tax. Now, this is something that was noted by the Kaiser Family Foundation. The Medicare Part 8 Trust Fund pays for hospital skilled nursing facilities. You know, we're talking about nursing homes. It's a nice way to say nursing homes. Home health, which is in-home health. These are like outpatient nursing homes where, you know, you're able to keep your loved ones at homes. And for a while after my kidney cancer surgery, you know, when my partner was on a different schedule, I had to have home health care attendant, which is a very humbling experience. But, you know, you have to do what you do for you and your health. So basically, the under the current law, Part A is financed primarily through a 2.9% tax on earnings paid by employers and employees, about 1.45% each. And the ACA increased the payroll tax for a minority of taxpayers with relatively higher incomes, those earning about $200,000 for an individual or $250,000 for a couple, by about 0.9 percentage points, so roughly 1%. So both of these foundations identified that the repeal of this tax is significant for the program's financial outlook. I mean, the organizations point to a report from a nonpartisan Joint Committee on Taxation that this repeal would cut federal revenues by $117 billion between 2017 and 2026. Because only the top 1% earners are subject to this tax, the benefits of the tax cut would go to the highest earning households, but the impact would be felt in Medicare's long-term financing. Like, you know, I mean, that's we're talking a significant amount of money. I mean, such a cut would likely lead to Medicare Part A trust fund to become insolvent 3 years earlier than projected. So the ACA was actually, you know, these are the things, they don't talk about the positive things about the ACA. You know, people think of the ACA as, you know, well, how much do I have to pay to the marketplace? But it's so much more significant than that. But in addition to the tax cut, there would be another significant Medicare impact from the AHCA. The Congressional Budget Office estimated that, well, we know with the Congressional Budget Office, the CBO, there was no CBO score during the new AHCA. It wasn't released until May 23rd, which was several weeks after it was passed Congress, which is despicable, and that's my opinion.
It's a shared opinion.
Shared opinion, but just speaking for myself, yes, it is a shared collective opinion. Payments to hospitals with many uninsured payments is, you know, that Medicare pays a lot of those disproportionate shared hospital payments, but the AHCA leads more people to become uninsured. These Medicare payments would increase by $43 billion over the coming decade. Like the tax cut, this would impact the long-term health of Medicare. People like myself that are duly eligible for Medicare and Medicaid and on SSDI, Social Security Disability Insurance, are most at risk. As previously stated, the MSP, Medicare Savings Plan, and Extra Help would be greatly at risk to lose its funding because these are the programs funded by Medicaid and allocated by each state. With less funding, both these programs are at great risk, in addition to people on SSD to losing the only income, a fixed income at that, that will literally defund people who are disabled by taking away some of the most important subsidies, payments for Medicare premiums and prescriptions. They will lose their Medicare and health care. For instance, without my extra help subsidy, as I just stated, I would not have been able to pay for my meds that help me manage my diagnoses on a daily basis. Dismantling the ACA, or as everyone loves to call Obamacare, which they're the same thing, which still kills, sorry, wrong choice of word. It dismays me that nobody realizes that they're the same program. And that you talk about fake news, that's fake news. Would likely mean higher premiums, deductibles, and cost sharing for the 57 million citizens and disabled Americans enrolled in the program. It would also bring back the infamous donut hole in Medicare's prescription drug coverage. The health reform law made many changes to Medicare. It slowed the growth of payment rates to hospitals and other providers, reduced payments to Medicare Advantage plans, and improved benefits for enrollees. Repealing the ACA would increase Medicare spending by $802 billion over 10 years. And according to estimates by the nonpartisan, I have to emphasize that word, CBO, which those, again, I will say with CBO, when you hear Congressional Budget Office, that is CBO. It's coming from our Congress. It's an independent, nonpartisan council, but it is still coming from our Congress. So as a result, Medicare beneficiaries would pay more. Premiums and deductibles are tied to the growth of federal outlays. So seniors would face higher deductibles and copayments for their Part A, which covers hospital stays, and higher premiums and deductibles for Part B, which pays for doctor visits and other services. The White House estimated that the typical medical beneficiary is paying about $700 less in premium and cost sharing this year because of slower growth and costs. Under the ACA, Medicare enrollees receive free preventative benefits such as screening for breast and colon cancer, heart disease, and diabetes. This provision will disappear under a full repeal, completely disappear. So these would become out-of-pocket expenses. And it's hard enough getting somebody or convincing somebody to get a colon screening. So if there was no financial incentive to do it, I feel that would be a double whammy right there. Trust me, it's hard enough to drink that liquid having a colonoscopy. From someone who's had 3 colonoscopies, it's not fun. But if I had to pay for it and do that, I wouldn't be able to afford to pay for it. I'd still want to get one, but basically, so we're talking about those things that would go away, the donut hole that would go away, and the most important thing is that higher income enrollees, however, would actually see some financial benefit from the repeal. The ACA froze the threshold for Medicare premium surcharge at $85,000 or individuals and for individuals and $170,000 for couples. So more people have become subject to it. The law also added a premium surcharge on drug coverage for wealthier beneficiaries. In other single payer societies, people understand that everybody pays for everyone, whether they're wealthy, whether they're poor, everybody takes care of everyone. And as I always say to people, we're always one health scare away from being bankrupt. So, I've heard from people that say, well, why should I have to pay for it? I'm not sick. I'm wealthy. Why should I have to pay for other people's health care? Well, you know what? Someday that might be you, because I was somebody who earned over 6 figures a year, and I'm not able to work anymore on a full-time basis because I have to be Peter, the professional patient, and I don't get paid for it. Unless you want to include my Medicare and Social Security disability insurance. And my way of giving back has been to help people in my lupus support meetings, to help them gain access to Social Security disability. Because when you do apply for Social Security disability, there have been surveys that have been done. There are actually 67% at the last survey that I read, actually, of people applying for Social Security disability get denied I fortunately was one of those people who actually got through on my own, which I was very lucky. And then once you get approved for Social Security disability, it's 2 years from that date that you become eligible for Medicare. So you still have to wait another 2 years. So some instances, if you are sick or that are waivers, I don't know the specific illnesses off the top of my head, but let's say kidney failure, that would probably be one of the ways that you wouldn't have to have that 2 year waiting period for Medicare. But just so everyone understands, it's not, somebody had said to me recently, I mean, I don't like to curse, so I'll just say effing. They're not effing entitlements. These are things that we as working people have paid into. Those aren't entitlements. Those are things that you have earned. And we all hope not to use them. We all hope that, we will live a healthy life and we will retire with savings and we will get our Social Security and we will have savings on top of that and we will be able to live a long and comfortable life. But for many of us, it just does not work out that way. And this is our life, and this is what we are faced with. And it's not a choice, and that is not really coming into play when we're talking about the AHCA. We're not numbers, we're flesh and blood, we're people. And, it's probably, I feel, a lot of the reasons that a lot of these Congress people who have voted for the AHCA have come extremely under fire because it is a very personal. There are a lot of things that are very personal decisions, a lot of issues, but this one is personal because it will, without that type of access and subsidies towards healthcare, it will kill a lot of people. And there's no easy way to say that.
Wow, that's deep stuff, Peter. I'm trying to get you to smile again because that was pretty deep.
I'm speaking from my heart.
Right.
I'm speaking from my heart.
Well,
unprepared. That was an unprepared script right there. That part. Anyway, sorry. Anyway, if you have any questions at this point, I've really given you a lot of information. Please stop me at any time.
No, you are doing good. I like having you on autopilot. You are doing phenomenal.
Thank you.
If you could speak directly to the Republican Party to repair the ACA instead of replacing it, or if you could just speak to the Republican Party, period, what message would you give them?
Now, is this me testifying before them, or is this just like me calling them up individually? I'm sorry.
This is you having the House floor and you speaking to them, and whatever your message is, what would you give to them? What would you say to them?
Okay. Well, I can't speak to this without bringing Hillary Clinton to this because, unfortunately, with all the fake news that was going on during the campaign, her messages seemed to be drowned out. But what was important is during the couple of debates, love her or hate her, she was very vocal on the ACA. And, we can all agree, and especially people who are in the marketplace, that the ACA is far from perfect. I mean, there are things in the marketplace, there are high premiums, and there are reasons for that, and reasons that I can't really elaborate here, but Paul Ryan has things to do with that as well, and pharmaceutical companies. And, the ACA, as far as Republicans were concerned, it was designed to fail. They wanted it to fail. They wanted it to fail because of the reasons that I previously stated. They wanted the not a single payer Medicare system. They wanted to turn it into a private paying system. So, when you have something that's designed to fail, it makes people furious. But even as the ACA is right now, the polls right now are close to 60% of people still want the ACA. Given all of that, given the high premiums, given everything, because it still gives you that access. And people want something they are sure of, not something where they're going to push through without a CBO score. But the two major things that it accomplished, other than increased access for people to healthcare, are raising the age of children being covered. So it went, people up to 26, and not like Trump said when he was interviewed by Leslie Stahl, children living at home. No, these are children that can live anywhere.
Right.
They were still covered. They didn't have to live at home. They could live anywhere, which made me cringe. But actually, that was the most normal he was after the election. I didn't get fooled, but it was nice to actually see him acting presidential for probably most likely prepared speech. But I don't even want to talk about that right now. But Secretary Clinton's, the two ways it did was raising the healthcare children being covered under the parent. And the other thing that it also accomplished was to get rid of pre-existing conditions. There was also a third way, which I had mentioned earlier, which was getting rid of the limits to how much you were able to be covered under your health care, because there were limits before. And that is such a crucial thing when you are facing a debilitating or a chronic illness. Having to worry, oh my God, am I gonna hit it, now? Because people can spend, millions of dollars on their cancer coverage. That's just the cost of our healthcare, and it's an unfortunate thing, but it's a realistic thing. But the reason I bring up Secretary Clinton is, she wanted to find, and again, this message was drowned out, and I heard it, and I hope you heard it, and I'm sure other people have heard it, that, there were ideas to make changes to the ACA, to enhance the ACA. The ACA was a foundation that was supposed to be built upon. You start with an idea, it's in place, it's working for people, and then you build that foundation. The proposed changes in the ACA, AHCA, would throw these protections out the window. And that, there's no compromise here. It is a nightmare. We were promised things by our current administration. He not only said he would protect Medicare, but he also said he would protect Medicaid. So he's getting rid of Medicaid through the AHCA, but through the budget cuts as well. So the Medicaid is affected twice. And excuse me, I lost my train of thought for a second. We were promised that, the things that we've heard, the AHCA is not an improvement. There is a better way. But it's a way that can't be rushed. Our leader seems to be focused solely on winning and losing. And if I met him, I would let him know there are no winners, there are no losers. But in this instance, there are people that would lose their lives, and there will be blood on your hands, and people will die.
I'm pulling my weight.